Sunday mornings at 10 on Talk 1470 WNN.
There's an unwanted guest in thousands of homes. It's opioid addiction. Think it can't happen to your family? 20 to 30% of patients prescribed opioids for chronic pain will misuse them. And about 80% of people who use heroin began by first misusing prescription opioids. Drug overdose is the leading cause of accidental death in the U.S. Don't be afraid to talk about it, because help is available.
This Beasley Best Community of Caring message is brought to you by Talk 1470 and 95.3 FM WNN.
Talk health, talk wealth, talk politics, talk 1470 and 95.3 FM WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is CareGiverSolutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on CareGiverSolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info. I'm your host, Marcia Teal, and I'm so glad that you could join us today. Whether you're listening to us in the southeast area of Florida on the radio, or whether you are joining us on your smartphone, laptop, or computer on the website caregiversolutions.info, I'm glad that you're here. We have another wonderful show for you today. It's a new year, a lot of new shows coming up, and I'm very excited about that. We are live here in Boca Raton, Florida. We bring information, advice, examples, real-life stories to you every week, every Tuesday, 5 to 6 p.m. Eastern Standard Time. And we have professionals that come on to the show that talk about all kinds of topics related to caregiving. It might be an elder law attorney talking about legal documents that a caregiver would need. It might be a social worker talking about emotional issues. It could be nurses, could be doctors talking about research. But we also have caregivers. And no better way to learn about caregiving issues than from someone who has walked or is walking in those shoes. So we have adult children that come and talk about caring for their parents. We have spouses talking about day-to-day challenges with their spouse that has memory loss. We also have grandchildren sometimes that come onto the show. So it's very important to get this word out, to talk about it, because it used to be that nobody wanted to talk about dementia. Nobody wanted to say the A word, the Alzheimer's word. President Reagan made that more commonplace when he came out and announced that he was diagnosed with Alzheimer's disease. And since then, now the word is spreading, and there's a lot of resources out there for you, and this is one of them. So I'm glad that you found us. Today, we're going to be talking to an elder law attorney because not only does she have her own practice, and she helps people, especially caregivers and people who need legal documents such as living wills and trust, and people that need power of attorney and that need healthcare surrogates, all of these things that are important to have as you're going through life to be prepared for what life brings. But she also has a personal connection as a caregiver. So we're going to talk to her and learn about her story. And so I'm very happy to introduce to you Arlene Lakin. Hi, Arlene.
Hi, Marcia.
Thank you for being here today.
Pleasure. I'm looking forward to it.
Well, you do have a special connection, not only as a professional attorney, but also as a caregiver. And we're going to talk about that. But first of all, I want to let everybody know that you are a board-certified elder law attorney in Broward County, and you have two offices, one in Pompano Beach and the other one in Margate.
Correct.
And you've been doing elder law for many years now. Mm-hmm. And I know you love it. I know that you love what you do and helping people with all of the legal issues that elder law attorneys can help with, and it's very important. Mm-hmm. So let's tell everybody, first of all, why you wanted to be an elder law attorney, because I know it wasn't something that you did right out of high school.
No.
What created that desire in you to become an elder law attorney?
Well, I went to law school when I was 40, and I went to law school not because of the elder law piece in my life. It was more because of my son, who's special needs, and he's the reason I went to law school initially. And then I opened my office out in Margate, and it's pretty much a senior community, and people were coming in for wills and trusts, and then they started coming in for public benefits, and one thing led to another, and then my practice ended up being predominantly seniors and people with special needs of all ages. And that's how it started. I really had no direct path. I just knew I wanted to do something that would make me feel good, that I wasn't just doing it for the money or doing it for academic purposes, but really to help people. And it just sort of all developed that way. It's a very human kind of a practice, because I don't do personal injury, I don't do any litigation. I just help families literally to find the best solution legally and actually socially as well, and medically, if I can help them. I'm very, best term is collaborative or holistic, in terms of trying to know all the resources out there and help people that I can, and not just legally, but in any way I can.
Well, heaven knows we need good attorneys, especially elder law attorneys, to help people through this maze that can be very complicated as people age. And as you mentioned, here in South Florida, we have a very large aging population, and they do have a lot of different issues, physical, mental, and they need guidance. And so thank you for doing what you do.
It's my pleasure. Thank you.
Now, one of the other things that I guess is very unique about you is that because of the population of your clientele, the older folks here that are coming in, like you mentioned, to get these legal documents, you're dealing with the elderly population, probably people starting when in their 60s, 70s, 80s probably, and they're coming to you for advice and guidance with the legal documents that they need. So as your practice has grown and you became an elder law attorney, what are some of the issues that you've noticed that these people are struggling with as they come to you for legal help? What are some of their personal issues that you've encountered?
I think the biggest issue is they're coming sometimes too late. They've already developed some form of dementia, and now they're coming to see an elder law attorney to do a power of attorney or a trust or wills or whatever. And they may lack capacity, and we're pretty much on the verge of guardianship, which is very costly and it's complicated and it's court involved. And that's the biggest problem. I'm always amazed when people are coming in at 90. I have clients in their centenarians in their hundreds, and they're coming in sometimes way up there, 70s, 80s, 90s, and they've never done a will, they've never done a power of attorney, they've done nothing. And now their children are dragging in their parents because they need these documents done. But the parent's been diagnosed with dementia. It depends on what stage they're at, whether or not I'll proceed with them. Sometimes it's too late. And I think that's really interesting that people have gone through so many years of their life and have never done any planning. And I mean, when they had young children, they didn't think to even do wills. They just never thought about it. And maybe I'm the only lawyer they've ever seen in their life.
Wow.
You know?
Sometimes people think it'll never happen to me. I don't need it. I don't need it till I need it.
Or they're superstitious.
Well, because they think that if they plan for their demise, it'll happen.
Going to happen. I
Wow.
always say, think of it like an umbrella. You keep that umbrella on you and it'll never rain. That's kind of the opposite way to view it. But boy, oh boy, people are very, some people are very peculiar about these things. Or they don't have, the other issue, I think, is some of the families are very dysfunctional, and that's very unfortunate. So they have issues with their children, and the children are fighting over the parent and control over their parent. And in those cases, I send them right to those litigators, and they'll make a ton of money off those families because they're fighting and fighting with each other. I mean, some of these issues are from childhood that have gone through lifetimes, and now the children are middle age or upper middle age, and the parents are still around. They're still fighting over who should help mom, who shouldn't help mom, and that's the first thing I do when I have new clients. It's very interesting, actually. You know how doctors have an intake sheet? It was just name, address, phone number, social security number, that kind of stuff. Well, on mine at page 2 is basically children. So most people, not everybody, but many people have children, adult children, when they come to see me as a senior. And almost within 5 minutes of them sitting down, after I offer them, a cup of water, coffee, tea, or whatever, I'll look at their intake sheet and I'll say, Mrs. Smith, I see you have 5 children. How do they get along with one another? I want to know at the very beginning of this conversation whether or not their children are, they have a healthy relationship or anything's dysfunctional, because that will affect my planning. And I don't think they're expecting the question, and I don't think they realize that I'm not just being sociable. I have a real reason for wanting to know that. And I learned that from the hard way, from planning for people when I was working with them. And then at the very end of a long consultation, I suddenly realized, well, their kids don't talk to each other, or they don't talk to one of their children or all of their children. I mean, there's interesting dynamics in every family. And then there's other families when I'll say to them, how do your kids get along? Do they get along? Well, they'll look at me like I'm crazy, because everything's very normal for them, and they think that's how it is for everybody. And it's fine. I always get a kick out of those families when they smile at me and they say, why do you ask that? I mean, everybody's fine. What do you?
But it's important, obviously, for you to execute a plan, right?
Yes.
To see if it's executable.
Exactly. If they don't get along, there's issues. Kid A doesn't like Kid D, but Kid D likes Kid B, and so forth and so on. And I need to know that.
Gets very complicated, doesn't it?
Yes.
Yes. So you mentioned that people come to you too late, because if there's an issue with memory loss or dementia, sometimes that you can't plan for the family because they've waited too long, and that person isn't capable of making those decisions for themselves of who they want to be their power of attorney and things like that. And then it would have to go into a guardianship situation, which is more time consuming. It involves the court system, and it's expensive too.
And it's lifetime.
Yes. So I hear you saying to everybody, get sooner than later all your ducks in a row, and because it's very important. So when people come to you, and sometimes there is a diagnosis of dementia, but it might be very early. It might be in the very beginning stages where the person still has the cognitive ability to reason and make decisions. But you see a lot of this in your practice, don't you, with memory loss? How prevalent is it?
In my practice, it's extremely prevalent. I'd say 80% or so of my clients have that. That's the issue. When the family member comes in and the parent has just a medical issue, bad heart or something like that, that's rare. I had one of those today, and they stand out because most of the time there's a dementia coming in. And not everybody gets dementia just because they're elderly.
Correct.
And people really need to be evaluated properly by the right type of physicians in that regard, because it's just there's so many possible reasons. You could have a urinary tract infection, and it happened in one of my family members recently, and they went completely bonkers, and they thought he was developing like sudden onset dementia, and it was just a urinary tract infection. So people have to be evaluated. But you brought up a point, and I wanted to develop it a little further, about doing documents for people with dementia, legal documents. It's challenging as the attorney to determine at what point it's too late.
Yes.
Some people, it's very obvious. I mean, they don't know they don't even know who they are. They don't know who their family members are. They don't know what planet they're on. I mean, they are gone. Mm-hmm. And I remember I had a case once where his son called me long distance, and he was coming to see his mother in a nursing home, and he called me and he wanted me to meet her there and do her power of attorney and documents like that. So I said to him, how competent is your mother? Oh, she's fine. And I said to him, well, if I prepare these documents and I go over there and I'm not comfortable because she's too advanced, then, you'll have to pay me. And I just want to be sure that, I don't waste your money or your time. She's fine. I said, why don't we do this? As soon as you come to town, call me. And after you meet your mom again, you haven't seen her in a while, call me. So he calls me and he says, she's fine. So I did the documents and I go to the nursing home, and the lady was literally sitting in a wheelchair with a bib on and drooling. She was probably one of the most advanced cases I've ever seen. And he actually thought that she was okay because he just was so desperate to get the documents done. But they couldn't be done, and I wouldn't do them. And then we get the others where they're not that bad. If it's early stage, maybe we can do it. But then it goes back to the same thing about the family members. I got to know if there's other family members who are not at that table. Literally, they're not involved. They're estranged from certain children, or one of the children is estranged from the other child, and I need to know the dynamics in the family.
Absolutely.
And then I'm not stepping into that quagmire.
Right, absolutely. Well, I think sometimes families are in denial of how bad their loved one really is involved into the dementia.
Yes.
And in this case, maybe, he was desperate because he needed it so badly that, he was desperate. So, the lesson here is don't wait until you're desperate, and do these things sooner than later. So we've heard you talk about your clientele and dealing with dementia. You seem to have learned a lot from them. But when we come back from our commercial break, we're going to talk to Arlene more about her personal connection with dementia and memory loss. So we'll be right back. Stay tuned.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related.
Share a story. Call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, and we're back. And my special guest today is Arlene Lake, and she is a board-certified elder law attorney in Broward County with 2 offices. And she's here talking about how people need legal documents, especially when you're dealing with dementia and not waiting too long. And so we've been talking about that, Arlene, and your clientele, and you help a lot of people, and the bulk of your business, your clients are elderly. But you have a personal connection too, and I'd like to talk a little bit about that because you help so many people, and these people are dealing with memory loss, all different kinds of dementia. But then, unfortunately, it entered into your personal life. Tell me what that's all about. It was your husband, right?
Yeah, it was my husband. My husband, Cliff, was a trauma surgeon in Broward County, very smart guy, physician, Duke University, Vanderbilt Medical School. He was wonderful and brilliant and terrific. So we built a new house and we were renting and everything seemed fine. I did not notice a thing. And he was working one night at one of the hospitals in Broward County on getting off trauma call, and he got a beep Remember the beeper days?
The beeper days, yes.
And this is 2010, actually. It wasn't that long ago. And so he said, I'll meet you back at the house. And I went home, and he came home, and he said to me, well, the medical staff people told me that they think something's wrong with me, and I need to stop working immediately and be evaluated for 30 days. And it literally was a stunning shock to me because I didn't see a problem. He had passed a trauma exam the prior year, and I didn't see anything unusual about him, absolutely nothing.
Wow.
And
but his coworkers did.
yeah, well, actually, what happened that day, I found out later, was that he got lost in the hospital. He couldn't find the operating room. He literally got lost in his hospital where he worked for 30 years.
And did the people, was that the only thing that happened that made them?
That was the triggering event. But I think that was one of the, it was very sudden. It was very abrupt. But I didn't even know that. He didn't even notice that was a problem. I mean, he didn't tell me what happened that triggered this conversation.
Okay.
So that was it. I took him to a neurologist that week and some other doctors, and he didn't even know what year it was. I mean, he did not know. He wasn't, he thought it was 1510. And I was stunned because I don't know how I missed it, but I missed it. I didn't see anything. And it took about a year and a half before we got a diagnosis because I having worked with so many people that have Alzheimer's, which is all about memory loss,
yes,
mostly short-term memory loss, and repetition in conversation. He never repeated himself, ever. Even when he was dying towards the end of his life, he never had Alzheimer's, and I wasn't sure what he had, so I took him up to Johns Hopkins in Baltimore many times, and ultimately we got the diagnosis of Lewy body dementia, which is very different from Alzheimer's. It's a different part of the brain.
Yes. Matter of fact, I have a definition that I want to share with everybody because Lewy body is a type of dementia. There are many different kinds of dementia. Alzheimer's is the most prevalent. It's the one that people hear about mostly, but there are so many other different kinds of dementia, like vascular dementia and frontal temporal lobe, which we've talked about on the show before. But Lewy bodies is a special kind all into itself. And one definition says that it is a progressive type of dementia that impacts patients' motor skills, basic movement, balance, memory, problem-solving skills, and often causes severe psychiatric indicators, including delusions and hallucinations. Would you say that pretty much describes some of the things that Cliff was going through?
Yeah, he really had no memory problems, though. I mean, at the end, maybe a little bit, but it wasn't at all like Alzheimer's.
But not being able to find the operating room. So
he was disoriented.
Disoriented, confused.
Yeah, I mean, I guess you could call that a type of memory loss, but it wasn't the type in terms of remembering events.
Yes, or names or people's
things like that.
faces.
No, he knew who everybody was. It was just, he had hallucinations all along, but never told me. And I realized ultimately he started telling me, but they didn't scare him. A lot of people with Lewy body have very violent visions, animals charging them and things like that. He didn't have that. He just was certain that people lived in our living room. He saw them. But
he never told you?
No, occasionally he would, and that's why I knew he had them. But at the later in the disease, he started having auditory hallucinations. He would hear people, and he started suddenly answering people. And he was always cleaning the tabletops because he kept seeing bugs and ants. But he wasn't afraid of anything. Some people get very violent and aggressive. He was always mild-mannered, thank God. He was a sweet, good man always, and he remained that way through the entire course of the disease. It was more of a loss of IQ. So I'll give you an example. We go out for dinner with lawyers, let's say, and other physicians, and he'd have a perfectly normal evening with us, normal conversation, no repetition, very nice, totally connected, great. And then we go home and he couldn't change the toilet paper. It was too difficult. He couldn't use a cell phone. He couldn't work a TV remote.
So some of that executive functioning.
Yes, it's like the IQ was going down. But he was so high to start that it took longer than the average Joe, to lose it all.
Because he was social and he still had the social graces,
yes.
So he could communicate and be in a group of people in a social situation and mask anything that might have been wrong.
Yes.
Wow.
Yeah, it was quite startling. That's why I took him to Hopkins, because nobody could really diagnose him down here. And these scans, the traditional scans, don't necessarily detect any of these dementias. depends on what they are. Certain ones can be cured. I mean, some people have hydrocephalus, that's water on the brain. And you can see that on these scans, and you can shunt them to get the fluids out, and they can be fine again. That's why it's so important. For people, medically speaking, and I'm not a physician, I just slept with one for a long time, but you don't learn medicine that way. And, I mean, that's one of the things that you want to do is
get
be
tested
evaluated because they need to rule out or rule in conditions that they may be able to cure.
Now, did Cliff have any balance problems or any tremors or anything like that? Because they say that sometimes, Lewy body is hard to diagnose, and they said sometimes it's misdiagnosed as Parkinson's disease because people can have these tremors and balance and immobility issues like Parkinson's. Did he ever have that?
He never had tremors. Never. And he was jogging most of the time he had this Lewy body dementia. His gross motor skills were normal until very late in the disease. And then he slowly started to lose his balance and then eventually couldn't walk or swallow. But, I mean, for many years during the beginning of the disease, he didn't have any gross motor problems at all.
When you went to the doctors and you finally got a diagnosis, did you know anything about Lewy bodies at that time?
I knew almost nothing. So I started reading about it, and of course, unfortunately, there's no cure for it. And I just knew what it was, and it's very unfortunate. But I tried something which I don't think I ever mentioned to you. But when he first stopped working, I had to work harder because, of course, I lost his income. There's financial, economic impacts of these diseases. He was working as a doctor, and then he wasn't working at all, literally overnight. And we had just moved into a new house we rebuilt, so I had to triple my efforts to raise funds to pay the mortgage, to take care of us, and so forth and so on. So I realized he was just hanging around the house, which is not good for anybody with dementia, all by himself, and he was fine in the very beginning of it, so it was still okay. He was even jogging in the neighborhood. But gradually I realized that wasn't safe, so I bought him a stainless steel dog tag with all the ID information, so if he did get disoriented, he could be brought back to the house. And more importantly, I thought he needed cognitive therapy, so I found a cognitive therapist at a local hospital. And he was driving the first 2 years of this disease. He was really very normal acting. That's why sometimes I thought he was almost playing a game with me. It was very unusual. It was very, very odd because he was so high functioning despite it. Because he never talked about the hallucinations. And as I said, we could have dinner and go out and be completely normal.
But how did he feel about giving up his career as a doctor, as a surgeon?
He didn't seem to mind. It was very interesting. He took it stoically. And maybe that's part of the disease. That's something I've actually noticed that most people that get different types of dementia, they don't necessarily go through depression. Their caregivers and their family members do, but they don't all go through it. Some do, and some don't.
Well, that's what makes it kind of crazy trying to figure out what's going on with somebody, because not everybody has, the exact same symptoms and signs that you would attribute to a particular type of dementia, because it's not all black and white. Some people do, some people don't. Some of the symptoms that are associated with Lewy body could be depression, anxiety, hallucinations, balance problems, problem-solving skills, the confusion, extreme fatigue, sometimes spasms, sometimes personality changes, and sometimes mood changes. But it doesn't mean they're going to have all of them.
Correct. Everyone's different.
Yes. And so that's what makes it harder to figure out, because a lot of these signs and symptoms can overlap and look like something else. And so you said that there was a particular kind of scan that they did. Tell me about that.
Yeah, that was very interesting. They started to suspect when he was going to Johns Hopkins that he had Lewy body dementia, but it was what we call a clinical diagnosis. So it wasn't based on anything, test or blood test or lab studies or scans. But there is a scan called the DAT, D-A-T. I cannot tell you what it stands for, but the D does not stand for dopamine, even though it really is a scan of the dopamine receptor of the brain, and that's where Parkinson's begins, and that's where Lewy body begins, and related Parkinsonian conditions. But the DAT scan was done at Johns Hopkins, and it was very abnormal. So at least we narrowed it down to that part of the brain. and that's where Lewy bodies are. And that's what it was. That's how we found out.
Because when they do the different scans of the brain, they can see what part of the brain is being affected. And for Alzheimer's disease, for instance, it would start in the hippocampus part of the brain. So with the Lewy body and the Parkinson, because it's in a different part of the brain, they can rule out other things.
Exactly. It's theoretically possible to have both or something else. There's Pick's disease, which is frontal temporal lobe. There's a whole bunch of different kinds of dementia.
Yes.
And you could be really unlucky to have multiples.
You could. I mean, we talked about someone that actually had vascular dementia and then got Alzheimer's on top of that because, they're both dementia, but they're caused in different
and
ways.
There's Parkinsonian dementia, which is different from Parkinson's and different from Lewy body, and it's all in that same part of the brain. So then you start getting to the clinical diagnosis based on symptoms when you do these scans. So the data is something to really consider.
So when he was given the diagnosis by the doctor, how did he take that?
Again, he stoically. There wasn't, oh my God, how terrible, I'm so depressed, I'm going to kill myself. None of that. He just took it.
But now that you said that, it reminds me that the actor Robin Williams, a few years ago, he was diagnosed at the time with Parkinson's, and then shortly after that, he committed suicide. And so everybody thought, it was because of that. But about a year later, his wife actually came out and said, well, they thought it was Parkinson's. It could have been that, but it was also Lewy body dementia. And apparently Robin Williams was very depressed, and so much so that he decided to end his life. And so, people react to it in all different ways. And, just look at the difference. And, Cliff accepted it and dealt with it. And obviously other people, go to other alternatives.
Robin Williams had a history of depression. I think he may have been actually bipolar to some degree. He was a unique man and quite an incredible talent, but he had a history of depression that predates the Parkinson's. But I think what I read about is that he researched it and he knew what to expect, and he just wasn't going to go there.
Right. He took matters into his own hands. So now you become a caregiver because as the time passed, Cliff is getting worse and worse. And we're going to take a commercial break, and when we come back, we're going to hear how Arlene became Cliff's caregiver and how she handled that. So we'll be right back. Stay tuned.
Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know. We understand.
We're back, and I want to take this opportunity to thank our national sponsor, Arden Courts Memory Care Community. Arden Courts has about 50 communities across the United States. They are specialists because memory care is all they do. And Arden Courts likes to help caregivers with resources. They have a resource library. They provide support groups and seminars. But one of the things that Arden Courts would like to do for you, our listener, is provide you with a copy of this book. It's called The 36-Hour Day. It's written by Dr. Peter Rabins and Nancy Mace. It's a wonderful resource for learning about dementia. It talks about the different kinds of dementia, tips and definitions and information that a caregiver would need to know. So if you would like to have this copy, it's absolutely free to you. All you have to do is give Arden Courts a call on their toll-free line, which is 888-478-2410. That's 888-478-2410. Let them know that you heard about this offer on the Caregiver Solutions info show, and they'll take your name and address and make sure that you get a copy mailed right to your door. So give them a call and ask for your free copy of the 36-Hour Day. I highly recommend it. So my guest today is Arlene Lakin. She's an elder law attorney and has her own private practice here in Broward County. And not only is Arlene an elder law attorney in helping people go through all that they need to know with legal documents, especially when they're dealing with memory loss, but unfortunately, her husband was diagnosed with Lewy body type dementia. And so, Arlene, you've been talking about the beginning when Cliff, your husband, was diagnosed, and it must have been very difficult because later you see things changing. How fast did things move as far as his progression into the disease?
Well, from diagnosis to death, I can actually narrow it down in that respect, about 7 years, which is relatively quickly. Although when we were going through it, it felt like an eternity because it's extremely terrible to watch somebody you love decline like that. He was better about it than me. I mean, honestly, he was a trooper. He was stoic. He was great. And I started to tell you, Marcia, what I did with my husband in the first couple of years, he basically led an almost normal life. He still drove his car and went out for meals with friends, and he drove himself to a cognitive therapist. But then I discovered some little surprises, like the cognitive therapist was giving him homework assignments because she only met with him for 1 hour twice a week, and that only lasted a few months, and then insurance wouldn't cover it. And he'd bring him these worksheets, and then he'd put him down, and he'd watch TV by himself all afternoon. And I'm at work, and I don't know what's going on, and it's just waste of time. Television watching is totally passive and doesn't help people with dementia at all. It's just like a child's toy. Mm-hmm. So I realized this isn't going to work. And I went out to a store, and I bought a ton of children's workbooks. I mean, seriously, I bought grades 1, grades 2, grades 3. Didn't matter the number. And they were word finds, word mazes, dot to dot, reading comprehensions, simple addition and subtraction, all of those kinds of things. And then I designed a whole curriculum. And then I hired an aide. We happened to be very, very lucky or smart. I don't know what you want to say, but we had really, really good long-term care insurance. And after a while, I realized he was vegetating at home, and that wasn't good for him. So I started using our policy, and we brought aides in, and I would train them to work on the computer. They had to be computer savvy to some degree. And so we had a schedule, and they had to stick by it. And I would tell them, I said to every one of the aides, as aides changed, that my husband did not have Alzheimer's, so his memory was normal, and he would tell me what they did with him during the day and what they didn't do with him during the day. And here's the schedule. So from 9 o'clock when I left to go to work, they had to sit him down at the computer, and if it took him 1 hour to send a 2-sentence email, so be it, but at least they were working his mind. And then they had the workbooks, and then we took down our children's Fisher-Price clock to have him practice telling time and writing his name, which is important. All the visual skills and playing dominoes, just games, hangman, anything. But I designed all this stuff.
You came up with all this idea yourself?
Yes, yeah. I created a curriculum for my husband. And then the aides implemented it, and they could break for lunch. And then the afternoon we had stuff that he had to do. And I told him no television. He will tell me if you turn that TV on. Honest to God, I was like an old school mom, but I wanted them to work with my husband.
Do you think all of that helped him?
I know it did, because I'm proud to say one year when we went back to Johns Hopkins, his test scores were better than the year before. They said they had never seen that.
Wow.
So it is possible to improve the quality of these people's lives. Now, ultimately, the disease got him anyway, but there was a period of time where he stabilized dramatically and, in fact, slightly improved. And so I gained for him maybe a year or 2 years of quality life that he might not otherwise
Because
have
of the
had.
stimulation and the activity that he was engaging
You cannot
in.
let these people just sit home and rot. Mm-hmm. But you need to have the right circumstances. I had aides, and I made sure that the agency sent aides that were computer literate and were English speaking and could work with him. And I interviewed the people they send. Now, some people can't afford aides. Some people don't have another family member who's around to watch all this. And so sometimes the family member they just ignore them. They just sit home all day and watch television.
Yeah, they really decline faster without that physical and mental stimulation.
Yes, definitely.
Mm-hmm.
Yeah.
Wow. So then toward the end, things got even rougher.
Oh, yeah.
And did you find that you needed even more help then?
Well, we had maxed out our insurance in terms of how much it would pay. And if you're a married couple, you know that if one of you is sick and the other one's well, and you use up all the money you have on the sick spouse, and the well spouse will be impoverished. So that was the challenge for me, is to be able to earn enough money to keep us going and pay our bills and take care of him, and yet not use up our retirement funds entirely on him, because I knew that most likely I would outlive him and I would need the money for me in my future. So that is a challenge, is to figure out how you can do this. But he started to decline, and it would go in steps. I used to say to people, it would be like 6-month increments. So for 3 to 6 months, let's say, he'd be pretty much the same as he'd been. And then overnight, literally, there'd be a dramatic difference. And he'd stay at that level, he'd drop down a little more.
So he did the plateau type of decline.
Yes,
because
down and then down, and then a few months, then down, and then a few months, and down. So he'd be stable for a bit. And as he started declining, number one, I took away the car. And I said that to him. I said to him, honey, you cannot keep this car, because if you hurt somebody or kill somebody, let alone yourself, they will sue both of us. Somebody will sue both of us because I let you drive knowing you were impaired. And that was really the only thing he was unhappy about, but he let me do it, was take away the keys and sell the car.
That's usually the big obstacle right there, is taking away that independence of those car keys.
I know. Well, but he didn't like it, and he mentioned it a few times. But even with that, he was just such a good guy. He just didn't make a big deal about any of these things. He actually was jogging. I think I told you he was jogging, and I got him one of the stainless steel dog tags, which I told him, you never take it off. You shower with it on. It's on all the time. And of course, in the beginning, when he was so high functioning, he would jog throughout many blocks in our neighborhood. And then as he started to decline, it wasn't physical yet in terms of gross motor. So I shortened his track. So he could only run maybe 2 blocks and would have to come back. But that's what gave him his independence. He just loved running, and he loved getting out of the house. But over time, he started getting very, very bad. And I had my own health problems at one point. And then one morning, it was pretty much over. He just woke up, and he was really, really completely mentally gone. He was just walking around ripping up pieces of paper. And I had been considered by him towards the end as the third shift, because we had a shift when I was at work, and then there was a night shift, because, of course, in a lot of these conditions, they become incontinent. So eventually I moved him out of our bed and into another bedroom, into another bed. And that's when I got the night shift, because I had to go to work. I couldn't stay up all night with him and go to work the next day. And in between, I was the third shift. There were times when he really thought I was the third shift, and other times he knew it was definitely me. But it was intriguing. And on the weekends, I only had a night shift. So during the day, he'd be with me, and we'd go to Publix together, run errands, etc., until the day that he woke up ripping up papers and couldn't even make sense speaking, and it was over. That was like the last drop before the end.
Well, I'm sorry for your loss. It's a horrible, long goodbye. You must have been exhausted, working so hard and caring for him and being the direct caregiver, but also, overseeing the other caregivers that you had, making sure that they're doing what they're supposed to do.
Oh, yes.
How did you cope with all of that?
Well, I had a heart attack in 2015, and this caregiving can kill you. And I thought I was handling everything so well, but surprise, there you are. And fortunately, I survived it. But that's about the time he started to get much worse. And then it was pretty much, I had to place him. I didn't want to. I know that's another issue for caregivers is they don't want to let go. I mean, if you had a good marriage, particularly if it's a spouse.
And you were married how long?
We were married 43 years when he passed away.
Wow.
So I mean, I really wanted him home, but I found a good facility, and we had a private aid with him because we had really, really good insurance. A lot of people don't have that, and that's a big difference.
Yeah, it's really, really tough. I know he passed away October of 2016,
Yes.
you said.
Yes.
And you know, I've heard that from other caregivers that go through what you've been through, similar situations. It's almost a bittersweet when they pass, I've been told, because you love them, you don't want to see them go, but you don't want them to have to go through what they've been going through. So you're happy that, or glad that their suffering has ended. And they describe it as bittersweet.
Yes.
Would you agree with that?
Absolutely. Mm-hmm. Yes.
What did you learn from being your husband's caregiver through his Lewy body dementia that you think that would be something to share with everyone, that something that's important that you felt that, gee, I didn't realize this. Maybe you never learned it from your clients or saw it in your clients that you dealt with all the time, dealing with memory loss. Was there something that you learned that you felt that impacted you?
Yes. Well, I learned a lot. And one of the things I learned which affected my practice positively, because apparently I was giving people misinformation for years, particularly about the real true costs of care, whether they're aides at home or insurance coverage that can be inadequate. If you're going to get long-term care insurance, you've got to get it before it's too late, before you yourself or your family members are already having some type of disease. And if you get inadequate insurance, it's not going to cover enough. In our case, we had a very good plan, but not good enough. The long-term care policies, they're expensive. And if you really want 24/7 at home, which I would have loved, excuse me, but you have to pay a ton of money for those kind of policies that will truly cover you around the clock.
It's going to cost more than you think it's going to
it's
cost.
Enormous. And so, and the cost of facilities and cost of aids, that was one of the main things that I did not realize. And yes, when the end came, I was almost praying for it, for his sake. I kept thinking, I'm going to die before him. I couldn't bear to see it anymore, to see him suffer. It was not good.
Wow. Well, again, I'm very sorry. We're going to hear from our sponsors for the last commercial break. And we come back, we're going to talk to Arlene about what happened after Cliff passed away. We'll be right back.
Do you need the advice of an elder law attorney? Perhaps
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know. We understand. We can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts.
disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, we are back. My guest today is Arlene Lake, and we're talking about Lewy body disease. Lewy bodies was actually discovered back in 1912 by a neurologist named Dr. Frederick Lewy. And he discovered these proteins that attached itself to a certain part of the brain. And so he was actually a colleague of Dr. Alzheimer's. And Alois Alzheimer's discovered Alzheimer's disease that was named after him. So Lewy body disease was named after Dr. Frederick Lewy in 1912. He was a German neurologist. And he saw that there were these abnormal protein deposits in the brain that caused the neurons to die. So Arlene's been sharing from her heart. Thank you so much for telling us about your husband's and your experience with him having Lewy bodies. Unfortunately, he passed October of 2016. But that's not where the story ends, because after he passed, you did something that not everybody does. So I want to let you talk about that real quick before we end the show, about what you did to help other people in his honor.
Well, as my husband was reaching the end of his life, it was pretty obvious that he was dying. He started sleeping almost all of the time. I mean, there were symptoms that he was dying. And I was not only depressed, but I was frustrated and angry, because I was losing this wonderful husband and this wonderful father and brilliant man and a great doctor, and I wanted to do something, and I couldn't save him, though I tried in every sense, but I couldn't save him. And then I started calling the physician up at Johns Hopkins that we had worked with, and I said to her, "Is there a brain bank? Is there something I can do? Can I donate his brain for research? Would that help?" But it was my idea. I just thought about it, and I thought, I can't just let this brilliant man just die and be buried, and that's the end. And it was all for naught. And so she told me about the various brain banks in Florida, and she mentioned the Mayo Clinic in Jacksonville. I said, but then you have to ship the body to Jacksonville, and you have to pay for shipment. So to make a very long story short, I found out about the Mount Sinai Hospital Brain Bank. It's at the Wien Center, and that's where I made arrangements to have his brain removed and biopsied.
That's down in Miami Beach.
It's down in Miami Beach, Florida. And actually, an interesting story, my husband and I met there. We fell in love at that hospital.
Oh, wow.
When I was in my early 20s, he was doing his surgical residency there, and I was a bilingual secretary. I used to teach Spanish, and I was waiting for a full-time job teaching. And in the meanwhile, I worked for the head of pediatrics, and I taught Spanish at night for the medical staff, and he was my night school student. And that's where we met. So in a way, he went full circle. And if you think that you want to do something like that, and I think it's so important, because that's where all the research lies. It's in these brain biopsies. They need the brains to do the research. And they also have a program at the University of Miami Medical School, and they have the program, of course, in South Florida at Mount Sinai, Miami Beach. But you have to plan ahead. You can't decide, oops, I'm going to do that after the person's died, because there's forms you need to fill out. They need the medical records, and they have to basically approve your loved one's donation of their brain. And it takes a little bit of time. My doctor up in Hopkins was very efficient. She got a disc done within 24 hours, and it was sent down to Mount Sinai, and I filled out the forms, and he was approved. And do you want me to explain what happens when the individual passes away? How they prepare them
real
for it?
quickly.
Okay.
Mm-hmm.
When the individual does pass away at the moment of death, you need to freeze their brain, their skull. And so they prepared, like you would put ice on your eyes for a headache or something. They made a whole ice pack for the back of his head. The brain is removed from the back of the skull. So if you are of the faith where you have open caskets and viewings, you would never know that anything had been done. And across almost every religion, it's allowable because it's medical research.
I see.
And
if that's the brain is extracted right
the brain
away,
is extracted
within hours?
Within hours, yes. And then they did the biopsy, and then they sent me the report. There was no surprise in the report. I knew what he had. And it came back, he had what's called diffuse, which means it had spread Lewy bodies throughout his brain. But I didn't do it to get a diagnosis. I already knew the diagnosis. It was more to help us all, and our children and our grandchildren and our great-grandchildren one day, to never have any of these dementias. So I encourage my clients, and I encourage people I know that run facilities that treat people with memory disorders to please tell them about the brain banks and to consider it.
It's very important research, because without people like you being cognizant and aware of the possibilities of, having a cure, but you can't have that if you don't have something to work on, obviously. And so research is so important. Mm-hmm. And thank you for doing that. I want to ask you if there are if there's anything that you regretted. Do you have any regrets throughout your caregiving that you didn't do something that you wish you had? Any regrets?
Well, the main regret I always had was that I wished I could have afforded to keep him home until the end. I would have liked him home forever, all the time, until the very bitter end. But it was financially not feasible, and I was getting sick. Mm-hmm. So
that's it. You have to balance the stress. You have to balance the care of the person who has
yes.
the dementia and the care of the caregiver.
Yes.
Yeah, and you don't want to have that so out of balance that you're getting down and sick, and that's always something to worry about. If someone is listening today and they know that you're an elder law attorney, we talked about that, and you help people with wills and with durable power of attorneys and with healthcare proxies and things like that, and other resources and other benefits that you could help them with, mm-hmm. and they would like to contact you at your office. Could they do that?
Sure, I would be very happy to help them.
Tell them how they can do that.
You can call me at my office. The phone number is area code 954-975-5159. And I have a website. You can read all about me, but now you already know a lot about me. There's not much hidden. It's at www.arlenelakin.com.
Okay. Well, thank you again, Arlene, for being here and sharing with everyone. I really appreciate it. And
I hope it helps everybody.
Giving us your knowledge and speaking from the heart. Thank you, too, for joining us today. I will tell you to come back next week, same time, same place, for another awesome program. In the meantime, don't forget, give somebody a hug, because they need it, and so do you. We'll see you next time. Take care.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on CareGiverSolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.